I'm going to show you a quick move. I don't know why I'm showing you this because I really barely use it anymore. It used to be a biggie, but now I'll usually go to the side I'm working on. But just to show you where he's at, now he's sort of had a similar lesson to this already this week, so he's going to be a little bit mobile, but we'll see. As you can see, one of the reasons why he's here, he had major foot surgery. So they broke the helix, which is the big toe, and put pins in the joints because his toe basically went over here on the third of the joint and they brought it forward. But I'm not working on the foot, I'm working on the pelvis. I'm just saying that this is going to, one of the obvious things that's going to affect his lesson. Everything in his life right now is affecting his lesson, but that's just an obvious one. Most people go for the obvious. But honestly, he could have fallen out of an apple tree when he was 2 years old and changed his life. You know, and until you're open to that, then you're only going to get stuck on the foot or the diagnosis or whatever people come with it. But again, so I don't use my muscles, my hands on the table, so I'm supporting myself, and I'll just look to see where his pelvis is at. So this is basically where I get with it. Now, because I'm showing you a lesson, I honestly don't care where his pelvis is at because I'm about to change it anyway, so, but I'm just showing you, and now here I'm just coming under with the hand, just like I call it, getting the pizza, and I just same thing, and there's even a little bit less on this side of movement. Well, this is what's nice on these balls. Notice how I immediately can affect that counterbalance. This is something, honestly, I'm just barely palpating my hand. And the balls immediately can start that infantile response of just counterbalance and start organizing the system. Now, he was a typical child, so that is immediately apparent. You had a child with CP or something like that, or a person with lifelong disabilities, if they've never learned that counterbalance, you're not going to see it in the balls. Would you like me to put a towel around you? Okay, because I can do that. Anything to make you comfortable, you know me. So, I keep saying this, I went to this horrible conference, I shouldn't say that, but I didn't feel like I got anything out of it. However, during break, a physical therapist showed us how to do a visceral manipulation. And that's where my brain was like, now this I gotta see. I've already applied it to how I do this work. So it's the only thing that I do that I'm going right after body tissue. Obviously, I'm not touching any bones here. However, my intention is still right to the vertebrae. Like if I add, like if there was a way of putting something through his body that I right now was touching the vertebrae, I would. And people don't realize, this is where I'd like to have a skeleton. His vertebrae is probably like this big. It's a very, most people only think of what he's lying on. But it's a, you know, your spine is a three-dimensional object and it's through your system. But what this does is I'm about to really change the way the reflex patterns work in his abdomen. It affects the changes in the diaphragm. I am going to do this on Ed today as well, just to influence the what he's learning today, so he can see it as well, and also because his son needs it. So you're going to start getting gurgles. Most people don't start right away. They really should. I mean, it's actually healthy when our organs talk. Most people get embarrassed. They're like, oh, I'm sorry, my stomach growled. Or, oh, you know, those are actually good things. They don't let you out of the hospital. They're not hearing any noises. I did something very similar to this just to show the power. People, some of you are quite familiar. I have a client who's on hospice. He's passing from heart failure, but he's 6'6". So he had his pacemaker had gotten staffed, so he had complications from that. Basically, almost like a year of the hospital. He's been in and out ever since. But he was supposed to die probably 3 years ago, and he's still. But he officially just told me he can't come anymore. So it's just about time. But he was NPO, meaning he had nothing to eat or anything like that for 14 days. and his colon was not starting up again. So for 6'6", and he's a big boy. Big boy. His pelvis is just a fruit ball. His femur, I always say when he does pass, I want his femur on the wall, and then I realize it's pretty sick, but it's like working on a dinosaur. He's just, and I say that because he's my friend as well as my client. But his stomach was literally in relationship so distended with just gas and air because, people think not functioning means I'm not having a bladder or bowel movement. Not functioning means not functioning. There's no contractions, there's no, nothing's going on. His distension was down 50% the next day, and his bowel started working. And I was really shocked that the hospital let me in, because that's where you get liability, not in America. Again, notice I'm not massaging. My touch here, I have to use a bit more touch, or I should say more square footage when I do the abdomen, because I don't want pokey. And I'm not massaging. I'm just... Now again, people that are trained doing viscerals do it for different reasons. There are chiropractors that do viscerals. I'm just talking, this is a visceral movement lesson. So this is just my adaptation on making eggplant. Now already you can see how I go, and the movement's starting to go through his body. Just to show you the difference, I'm going to quickly go over here. You get my bum. Just to show the difference. See, I'm not connected through the system. There's some movement, but right there is when I felt his system go and start to connect with me. See the difference? I'm still not anywhere to where I want to be. I'm just saying that's where I suddenly feel, okay, I'm truly with his system much more. Now there could be a lot of things. You really have to get permission. A lot of women don't like you to just suddenly start working with their bellies. It's probably one of the best things you can ever do with a female, because especially after having babies, fat tissue, whatever, women almost look at their stomachs as if they're like third world beings, I wish it would go away. Well, it's a part of you, and what are we going to do about it? And this organizes all of that, especially after childbirth, back into the system. Not that this young man has to worry about his uterus right now, but... So now I'm much more, and you can see where I'm working with the spine. And again, it's not that I'm shaking a person. I'm actually just looking for an acceleration increase in the movements through the skeletal system. By all means, there are methods out there that are just rocking. I'm not a rocker. Now, just from that little bit, I'm going to go back just to here, just to show you the difference of just where the pelvis is at. And I can do this side too, just to show you there's increased movement just from the counterbalance through the system. Are you comfortable?
Yeah.
And on this side too, if no one's familiar with basic anatomy, it's not that I'm affecting it. On this side you have the liver. So the liver comes down through here. So stomach, liver comes down under the rib cage, but it'll expose itself. And then obviously you're dealing with the small and large intestine. So in some people too, that have issues with the liver or whatever, the liver can actually feel quite hard, which is not a good thing, but it can. So, and this will help the circulatory system of the organs, all the organs. But even if the liver doesn't feel hard, the tissue on the right side is different than the left side, period, the end. The right lung is longer and larger, it has 3 lobes. The left lung only has 2 lobes. The stomach, there we go. However, his right side is getting much more organized at a quicker rate. because of the lift. Now again, I could have spent a whole half hour doing that. I'm only doing that part because now I'm going to show the visceral tissue because I'm working with the pelvis. So again, just to show you this side and how, and also to look at the belly. This is how we should be as far as I'm concerned almost all the time. I should have done this ahead of time, but we're 85% liquid. It should be just like I'm throwing a rock into a pond. You should be able to get that movement through the system. When your belly's hard, even if you're, excuse my French, fat and whatever, that's not a good thing. Your circulatory system, you know, it's half the reason why people have irritable bowel and all this sort of stuff, because it's just too much work for stuff to get through your system. Now, I'm not saying you don't have allergies and blah, 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 don't beat me up on the internet, but it doesn't help, let's put it this way. You need to move. Everything in your body needs to move. And if your organs aren't moving, and this goes to, like yesterday, I worked with him just on the patella. You know, it's amazing how just this little, just working on the bone of the patella, the knee bone, affects, there we go, affects movement through the system. So what I'm doing is I'm using my palm heel, and I'm doing the palm heel on both, on the hip as well as the belly. And now I'm just going in and just not only making contact with the hip bone, but I'm working on that counterbalance. Do you have any questions?
No.
We'll say this for the whole week and then he gets home and he kicks himself. So now I just tease him. At least I asked. So now I'm going to go in underneath with the hip and the pelvis, SI joint, all of that. Again, just because when I say hip, now what I'm working with a little guy whose hip now is off his iliac crest. He's had 2 hip replacements, you know, so his movements are going to be different. So when I say hip, you have to go with the person's hip. And now I'm going to go off to the femur and just to connect it. What I'm doing here is, see, I've got the circle. I've got the gyro starting to work here, function the system. So now I'm starting to just connect each part to that. I could just work here. It is a different movement versus working with, again, I'm going all after the counterbalance. And by the way, this movement, in a sense, or this understanding is crucial to your son and to your son. To anybody, but.
Can you do it in 3 ways? First, the one you are doing, with the organs and bones, and then to stabilize the organs and to move the bones, and then to put the hand off and then just look at the bone.
Sure.
Got it?
So what I'm doing here is I'm actually pushing in into the organs and rotating the hip.
Okay.
Feel that?
Now stabilize this hand and just do that.
So now I'm just going to hold the organs here and feel this.
Okay.
What I would do more so with that movement probably is I would come underneath the knee, push, stabilize the hand.
And now that's another story.
That's another story, but I'm just quickly saying this would be more my option. I'm actually engaging the vertebrae, the back down to the table and the knee coming up. And so now the third option was not having the hand here and just feeling the leg and this movement. Oh yeah. But now, because of what I've done here, I can come into the chest cavity. I can come into the pelvis here in the chest cavity and start working and see how the belly is just freeing. So once this changes here, does this mean the internal organs and the connection? You really can get underneath and start working on different. So right now I'm actually going after the lower lumbar and the vertebrae. So as I move my hand, again, it's all very similar how I work with the foot. It's like my hands are like this or like this. They're connecting even though there's a body in between it. But I'm still, as I dance, as my right hand does this, I'm countering always that. And also too, I don't stop unless it's purposeful, this hand, as this hand continues the rotation. So even if the movement's a 1/16 of an inch, that's all it is. Did that help doing all three?
It's maybe because of my organ training, is that when you are moving from the organs, you move the container. I mean, you move the content to move the container. It's like you have a balloon with water,
Right,
and you imagine that you could move the water,
right,
then you move the balloon.
right.
In the second, when you stabilize the organs, and then you are like, that's what we call counterbalance. You are moving the container, but if the organs are stabilized, it's like doing this,
Right,
like in the ball socket jar. But when you drop this, in fact, this is still working. It is facilitating when you go from the balls, from the container.
right,
Like it's not that you move it in a block, because you move it from here to get the move here. Then you move it from here, it's still alive. When you drop it, it's like you got this.
right.
That's what you call counterbalance or not?
No, I'm looking for more so, I refer to going back to the torque. When I touch, nothing on the human body is straight, and that's why I was quickly doing a thing on movement. So when I'm touching you, I'm touching, let's say, and that touch is going, for lack of a better word, it's from the right side to the left.
Mm-hmm.
That's my direction or intent of the movement. However, since you're curved, the touch is really going down here and
Yeah.
around and over, and so I have to look for where there are maybe complications or situations where I might, maybe when I first touch, it only goes to here.
Mm-hmm.
So that's why I'm working with the visceral tissue. So I'm dealing with, so as I rotate the knee and going around with the leg, I'm looking to see how the force bends through the system and how to get that to be a clearer line of sight or a clearer direction. So instead of going around the liver, let's say, by doing this, now they're like, oh, I can be included in this movement, you know, when I go to stand, versus when people go to stand and their body kind of hang, you know what I mean?
Mm-hmm.
So it's all incorporated. So, but probably if I sat down and read more Laban and whatever, that probably the points are very similar, but I just don't think or have that vocabulary.
Okay.
And that's why you're here with me, because you don't have my vocabulary. So I don't know which is more dangerous. So that was one example. So now my next example with that is if I come to the foot, now I'm not touching the organs anymore, but just to look to see how I can increase that connection. So I'm gonna come here. Now this stuff I don't expect y'all to get. Right now today we're gonna sort of just play with bellies and the pelvis, but I just wanna show, I'm quickly just organizing his leg. Okay, there I am. So when I'm working with something like this, I can work now already with the pelvis, but it's almost like for the first time where it doesn't happen all the time, my intention is much through the spine, like sort of through the belly button. So, and that's where my eyes can just visualize the skeletal system, but normally I would do this, like right here, I'm touching to the hip joint. But now I can just change that a little bit, and now I'm going right into the organs. Does that make more sense? This is a very complex. I don't expect you to be able to touch like this, but I just want you to start thinking. There. But I'm just showing too how parts hook up to the gyro. So now I'm going to do a different thing over here, again, just to connect this leg into the pelvis. So now here I'm gonna go through the knee. Now, a lot of this would consider this a pre-crawl. So if I don't have to get him to crawl to have him experience it. But see already how the diaphragm and all of that is changing. And also, I am instilling crawling and there's no inflection in the belly. So when babies go to crawl and their bellies are inflected, then the head comes down. You know, he has a nice loose belly right now where the head would be able to come up to stabilize the back. And so that's where I'm working on with the knee. Of course, I'm touching the foot to include. Now, if it's a true crawl too, I can always be on the top of the foot because if he was crawling, that's where he would have the information. I have to be very careful with his foot and how I apply touch, but I still can incorporate it. And with that, now I can come underneath here also and work with that. See, he's got a little bit through the tailbone where he jumped on me. So I went too fast. Did you feel that?
Oh.
No? So when I went like that, you didn't feel it right there with your tailbone right through here? You're just catching yourself? There, now it's easier. At first you just guarded. You weren't prepared for me to go in there like that. Does that make sense? You know you got my butt? Now, this is the one I truly don't agree with anymore. I'm going to do it to show you it is done. I would be doing a whole lot more work first, maybe with the shoulders and the arms. But to come around, I know you've seen me do this before. I can very easily, now I know he's much more athletic and organized, so I can take advantage of him. And I can work here. Now here you can see where the chest cavity is not really tied in with the organs. Does that make sense to you? So I'm going to come back here quickly and I've now changed that subject. I knew he wasn't ready. I probably shouldn't have said it because I also could be putting thoughts into his mind. So I'm just going to go in and say from this angle. So right here, his chest cavity. And this is where if I touch something, I've got to go with it. So quite quick. So now just from that, and this is where you do your service. Come in here again. See the difference? Now it's still there. Also too, the other day I worked on this hand, but not on this hand. So now I'm going to see where he is with this. This meaning his right hand. You can feel the difference. Hand's very heavy. I'm only going to get it to here. But again, I'm just looking to attach the extremities to the abdomen. It's not a lesson about the arm, but now I know he needs it. So that I'll have to do later with him privately. Does that make sense to you? Mm-hmm. Okay. And now I'm going to take out this pillow. Now this pillow too, I could have used a judgment call. I've kept it more in line. You know, he seemed comfortable. I didn't mess with it, but and I've also messed with his head the other day for probably about a half hour, so he's quicker right now. Please don't ever think that you're going to just pick up someone's head and just go, oh, wow, you're doing great. For the most part, you're going to get that. So I've attached to his spine, and again, I'm going very quickly, but just to show of bringing, and he really should feel, that's probably why he giggles a little bit, that belly just going plop, plop, plop. You might even feel his diaphragm at this point just flopping back and forth. And now I'm going to pull him. See, that's harder to do. I would have to go underneath the arm And more, let's see if I can get more quickie. And no talking. There we go. There we go. Now you can even hear his belly. Let's see it. So again, this isn't necessarily a lesson that I would do for someone, probably, you know, because yours is much more different when I did it to you. I'm just doing to show the powerfulness, the power of the gyro in relationship to the rest of the system through the stomach and the visceral. So, did that make sense to everybody?